যখন ফিল্ডে আসে তখন আমরা পরে নিব এটা তো এখনই ফিল্ডে আসবে আমাদের মার্কিং এর জন্য তো লাগবেই we need
Siam.
combination
Okay. I am giving you the max for scope. You just start.
Okay.
Hello?
Hello?
Can you hear us?
Yes, we can hear your sound.
So before starting procedure, can you please review the MRI again? So there are some new spectators here. This will be easy for them to understand what procedure you are going to do and what's the indication for this procedure.
Yeah,
the MRI, please review the MRI for us.
We will review the MRI, Azam. This patient have a mainly C7 dermatoma of left side. You can see there have the huge disc herniation in C6, 7.
Please.
Yes, Azam will show it.
Please zoom. Azam sir, please show us.
Can you hear me?
Yes,
Hello?
sir, we can hear.
Okay. This is 45 years old gentleman having the neck pain with left-sided radiculopathy. Actually, the patient is suffering from radiculopathy.
Yes, sir.
And on MRI, you can see that a
small scope. Small scope?
You can see here.
No, scope. Scope. Working sheets.
You can see here.
Joint?
All
It is
the
joint?
films is there, and only if
Joint?
you see here,
it's so big.
at the left lateral foraminal view, you can see there is a disc at the foramen.
Yes, sir.
You can see here. Clear? Zoom.
Clear, sir.
Zoom. Then if you see the axial image at the same level here, 6, 7, this is the disc. This is the disc. This is the disc. And this disc compressing the root, exiting root.
Yes, sir.
And this root creating the problem. So we will do posterior cervical laminoforaminotomy, then discectomy. So we will go from the posterior side and drill at the laminoforaminal side, open the space, then remove this disc fragment.
Yes, sir. Thank you, sir.
Okay.
Yeah, today I'm also doing the partial pediculotomy, partial vertebrotomy, posterior PCF, but today we prepared not small scope, only large scope, because of that partial vertebrotomy is possible, but partial pediculotomy is possible. But partial vertebrotomy is not possible because of the partial vertebrotomy usually insert the working sheaths and then protecting the nerve, then drilling the vertebral body, because that is not possible because this working sheath is very huge. Can you understand? Because today we will do some pediculotomy and then discectomy with no partial vertebrotomy. Okay? Okay. Siam, please. Yes. Mess? Mess? Knife. Usually, I skin is the P-shape small scope is in the transverse skin incision, but with the large scope is decompression vertical skin incision. But today I use the large scope because of it. I will insert the vertical skin incision. Okay. Because of that, some small P-shape discectomy cases usually they have no revision is usually not needed, and also extended laminectomy then not needed because of the transverse skin incision make some skin crease and decrease the skin exposure after operation. But in the stemless cases, they have sometimes some revision and some extension of the above level. Because of that, with the same skin incision, you need sometimes revision surgery than needed because vertical skin incision there is more benefit. Okay. On. I cannot see it. It blocking. Rotation, tilting. They be looking to here. So tilting, please, tilting. On. Some more tilting. Okay. Okay. So long distance from here. I cannot see. On. Shut. Shut, please. Okay. I cannot see. That is correct?
This is correct, and that is the medial border.
On. On.
This is the T1.
Yep.
Okay, this is 7, this is 6.
On. Shut. Okay, correct?
Correct.
You need some deep skin incision will be very important because of the so fascia in the most cervical area is so thin, thick here. Okay, working shears. Some, please up.
Add ceramic to be read by light take to the
Okay. Please come in.
আবার শট, আবার আরেকটা শট।
Sitting.
ঠিক, ওইদিকে ঠিক। হ্যাঁ, ঠিক আছে। ওকে ওকে। Okay, it's okay. It is okay.
Level is correct. I cannot see.
Yes, sir.
Where?
Down.
I cannot see. T1. There is T1.
T1. There is C7.
On.
C7.
On.
C7 is this.
On. Yeah. On. Shut.
Little. You are in the little bit down.
Shut. Okay. Correct. Correct. Okay. Please. Back, please. Okay. Our first target at this situation will be the finding the facet and V point. Okay? V point.
এই কাটো 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 বাদ দিতে টাইম লাগবে
Breathe on. Breathe on. Please light off. Light off. Okay. RF care. RF or care anything?
আরে বড়টা কি কাজ করে কিনা ওয়ার্কিং অর নট জাস্ট চেক
Now play. No,
নট ওয়ার্কিং
not working.
চেঞ্জ
Force, force.
চেঞ্জ
Force, please. Force. RF.
এখানে ওই পাশে একজন দাঁড়াও না।
Play? Not play. Not play. Yeah, 3. Okay. 3. Three. Okay, three.
পানি ওয়াটার পানিতে একজন থাকো।
পানির ইয়েটা মনে উঁচু করতে হবে, পানি আসছে
RF.
এর নিচে ইয়া দিতে হবে।
Okay.
দুটো না একটা।
RF. RF.
না এটা পানিটা নিচু হয়ে গেছে,
নিচু হয়েছে বলতে নাই তো স্ট্যান্ড নিচু করা। একজন এখানে থাকো না।
এটা স্ট্যান্ডের উপরে দাও।
Okay, play good. Firstly, we should finding the viewpoint, but before we checking the where is the pawn. Yeah, touch here. Here is pawn. Okay, I see. Here is pawn. Here looks like a facet here, maybe. Facet. I don't know still. RF. Three. RF. Yeah.
I'm okay.
On. Okay, here is facet. I see. Yeah, here. Facet. Yeah, here. Three. Then here is facet medial border area. Then more easy. Now we can find easily the viewpoint here.
We are reading over the pressure joint.
RF.
আরেকটা আরেক রেডি রাখো।
On. 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 Okay. On. RF. On. Okay, three.
Hello?
Yeah,
Who is part of whose bone you are drilling?
we still finding the facet area. We don't know still. I'm not finding the anatomy.
Okay. We are finding the gap.
I'm still not finding the correct anatomy. Please wait.
Okay.
RF. Share one more time. Share. On. Okay. On. Share, please. I think that here is a facet here. There is a 71, it looks like. Okay. Three. Wait. 여기는 아니고 여기란 얘기네. RF. Please insert here. On. Nice. Three. One more. Insert. On. Okay, three. 이게 아닌 것 같은데 이것은.
Hello.
Yeah.
Theoretically, the drilling area is the we say V point. That is
No, I'm still not finding the anatomy correctly.
Okay. He will show. Dr. Kim will show the all points.
Shyam,
That is the
please.
upper margin of the lower lamina and lower margin of upper
Three.
lamina
Three.
adjacent to the facet, and the part of facet will also removed. That is the point he is doing the drilling.
와우, 이거 완전 통뼈네. RF.
ইরিগেশন হচ্ছে না, irrigation।
On. RF. 프레저. 플루이드. On. 오케이. 오케이. Drill. I see. Drill. RF. I think here, first here. It looks like here viewpoint, but I'll check it. Okay. Okay, 3. Siam. Siam. Can I show the Siam? Siam. RF. Okay. On. On. One more on. Okay. Okay. Siam.
পানি বন্ধ করো পানি
No, no. It's okay. I'll check it.
ঠিক আছে ওকে ওকে
Ajahn, please check the level. 6, 7? 6, 7? Okay, okay. Okay. Friday. Okay. 3. RF. On. Oh. Oh, not blocking. 3. Here is a spinal cord area here. Here is a foraminal area. Wow. I don't know. On. On. 프로브. 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 김스 프로브. 마이 프로브. My proof. This is not my proof. Oh, that insert. Oh, this. Yeah, not play. Okay. One more. RF. On. Okay. On. Okay. That's more clear. 3. 3. Sorry, now the drill is so weak, and the bone is very strong. Yeah, here is a V point, inner V point here, forcep. Forcep. Okay. 3. Okay. RF. So bleeding. This patient have a bleeding tendency. On. On. Yeah, but here around the root here. 3. Here is around the pedicle of the upper vertebral body here. 3. RF.
Here in the facet joint.
Yeah. Here is a upper pedicle. Here. Yeah. Here the root area here. Okay. 3. Okay. We can move.
Hello, audience.
Yep.
Audience, can you hear?
Yes, yes, we can hear and we can see you.
Okay. Now he is drilling at the facet, medial part of the facet actually, and you can see the facet junction.
Yes,
The white one is that is the junction of the superior articular process.
yes, yes,
This is facet space.
yes.
And already we have seen the root there. Root is exposed
Okay.
a little bit.
Root cellular near root.
Yeah. Okay, oriented now, I think.
RF. Okay. Here is a low pedicle here. Yeah, three. Normally it needs sometimes some for drilling. To make a sufficient space, it maybe need some pediculotomy like this way. Oh yeah. Where is it? Huh? RF. On. I don't know. 아직 또 돌리진 않았는데. 오케이, 드릴. 드릴. I think that we are now exposed. Okay. Here is a pedicle here. Okay, I see. This fossa. There is nerve. Okay. Can you give us some small forceps? Oh, so large. Okay, it's okay. Then RF. Okay, here around the nerve. I don't know. A play? Here is a pedicle here. Okay, drill. Drill. Yeah. Low pedicle. Low pedicle. Here looks like a pedicle here. RF. RF. Why the sound is here? 소리가 왜 안 나오지? Why the sound is not here? Okay, three. Okay, I see. Understand. Three. I don't know. We point already. No. No, we finding the pedicle, but we
Hello.
cannot. Yeah, RF.
Yes, please. Anything you want to ask, I think.
Sensei, you want to say something? So,
Punch,
Kuama Sensei has done a
punch,
extraordinary
punch,
procedures
punch,
today.
punch.
And we can give a big clap to them for their extraordinary performance and the trouble they took for us. They have came to Japan, and there was another 12-hour transit in Hong Kong during their travel. So basically they had a hectic journey, and they did hard work to come to Bangladesh and perform extraordinary two procedures. And it's nice to inform you that both the patient is doing okay after the procedure, no deficit.
RF.
And we can give another big clap. So now Kuama Sensei will say final remarks to the audience and leave for today. Thank you.
Okay, thank you very much for joining us. Today we did two cases. It was terminated very safely. One with the dural AV fistula, which is a very difficult case, and the last one is ruptured ICA aneurysm. Also, this was so difficult, and we have a little complication. When we go into the internal carotid artery, a microemboli is going into the distal MCA branches, but we did clear the clot by microcatheter. And after that, we did very nice embolization to the cerebral aneurysm. Thank you very much for your joining.
Provo.
And if you have any questions, I can
Provo.
answer you one or two. Okay.
Hook.
We did many questions during our procedures. Anyhow, we are very, very happy to be here with you to share
No.
our
Small hook.
technology and knowledge with you all, young neurosurgeon. Thank you very much. See you tomorrow.
Three. 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 I see. Okay. So bleeding. RF. Okay. Three. No, this is some problem is that. Three. I see. Here is a pedicle. Okay. Instrument is not full. There is a problem. Don't worry. Maybe. RF. Okay, here pedicure. Okay, I see. Drill. Yeah. Here, have a pedicure here. Okay. Okay, RF. Prove. Oh. No, three. Three. Okay, RF. So bleeding. 프로브. 프로브 먼저 잡았어. 프로브. First proof come. Okay. Here is actually here. Rupture disc may be located here. Around here. But so bleeding. Hook. That is a rupture disc. Yeah. That is not good to me.
This is the disc.
Yeah.
Yes.
Hello, audience. Can you
Yeah.
hear?
Yes.
What's that?
This is
Yes,
the disc.
please.
You can see the disc is protruding out.
Yes.
What's that?
Force
Not so good my operation.
This is the last of his operation, actually.
Small scope. Small. Mm.
Small. Okay. আরো ছোট নেই একেবারে ছোটটা Okay, finish, just finish.
Great.
Hook. Hook. Today, all insurance is not adjust to me because operation is not easy. Today, I will finish
You can
after.
see the last fragment
Yeah.
coming out.
4 This is not my technique.
Okay.
I don't like it.
Okay.
Hook. 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 What? 보세요. There is sufficient. Okay, I think that maybe today we'll finish here. Okay, no. Drill.
Drill.
No. Okay. 보세요. Small faucet. Yeah. Okay. Yeah. Very small. That's good. Hook. Hook. Okay, it's fine. Okay, it's all finished. 보세요. Pressure, compression, fluid, yeah. Okay. Okay, now we can see the nerve here. This is foraminal ligament. This is not nerve. This nerve is here. Prove. I will show that. Here is a foraminal ligament. Nerve is here.
This is the nerve.
Okay.
You can see the nerve,
Yes.
dear audience.
Yes.
And the root located here.
The
Okay, I will finish the operation to here. Okay.
he removed the disc from the shoulder side of the nerve.
Yeah. Okay, that's good. Drain and RF. Disc? I already mentioned that we have this is big size disc is traction and is a very danger because I'm only doing the today partial pediculotomy. Partial in need prove. Usually I'm doing prove.
Okay.
Inserted working channel, small working channel to here, and then can possible retract to here. This is possible because of that. I can check to here is possible to here, but today is not possible. This patient already, the patient symptom already sufficient to solve it with the huge disc removal. That is sufficient. Because this patient, fortunately, only problem is disc pathology, not stenosis. That the patient symptom will disappear. That's good.
Thank you, Professor.
Thank you. Kim sir.
Thank you.
Big
For
clap for
nice
Kim.
demonstration.
We are coming.
A big applause for you from the audience.
Yeah.
Thank you again.
Thank you.
for nice demonstration of cervical endoscopic surgery. Thank you, Khoshu sir also and Azum sir also, who are there. This was very inspiring for us to new and to learn the new technology of the cervical spine surgery.
Also, unfortunately, today the operation field is very crowded and working approach is very some difficult, but usually more easy and more clear with some good oral setting of the instrument. Because of that, today only showing operation. Okay?
Yes, sir.
Okay.
We have seen that the field is sometimes blurred, and you have done your job in this blurred field. But we, who want to do this in future, are pretty afraid that how you have did this in this field. It is this kind of experience is really inspiring for us, and I will ask you some simple questions like that. Is there any kind of probe or something else you used to make the field clearer so that we can do the job without any affright or without more excellency?
Okay.
He is asking about
Any
the
new
instrument.
technique or any new probe you used?
Instrument to clarify this field.
Actually, the
Laser field.
bleeding more clear rather than this with some. I think that maybe this patient have some bleeding tendency. Meaning that so severe vasculature already increased because of that some bleeding. But anyway, with the set up the some pressure, blood fluid irrigation pressure, and good RF coagulation setting. So we cannot hear the sound of the coagulation sound. That is very important. Why we always with the sound some coagulation the bleeding point.
Good RF will help us to make our field clear.
Yeah, more clear.
Yes,
Commonly, P-shape always very clear view.
Yes.
Today is very blurry.
Dear audience, please wait for a moment. We are coming in the auditorium.
Okay,
Just
sir,
wait
here,
for a
please.
moment.
Okay, sir.
Please, everybody sit there. No, don't go outside. We are coming at the auditorium.
Okay. Thank you.
জি সবাই একটু দয়া করে বসেন জাস্ট 5টা মিনিট ফরেন ফ্যাকাল্টি এসে আমাদেরকে ফর্মালি একটু মানে হ্যালো বলে যাক জাস্ট 5টা মিনিট